Welcome to Talk 1260 KTRC, the Humanity Behind the Vanity. This is Dr. Daniel Ronel. I'm here with my wife, Betsy Ronel. We've got a show about plastic surgery. We're going to talk about that, and we're going to hear a tip from Dr. Rita Dodge. I wanted to thank our generous sponsor, Suniva Medical, the makers of Artifil. And
Okay,
do you have a
I
public
got
service announcement to make?
Oh yeah, sure, I'll do it now.
Okay.
So, as many of you know, but some of you perhaps don't know, Amma, the world-renowned humanitarian and hugging saint from India, she used to be called the kissing saint, but I guess now they've termed her as the hugging saint, because perhaps with all the germs in the world she stopped kissing people. She will be visiting Albuquerque for free public programs to be held on June 20th and 21st at the Marriott Pyramid North, just off I-25. Throughout the world, Amma has been recognized for her selfless efforts to aid and uplift suffering humanity and for her establishment of the extensive charitable activities worldwide. Recently, Amma received an honorary doctorate in humanitarianism from the University of New York. Amma was also the 2002 recipient of the United Nations Gandhi King Award. Well, that's a big time. I mean, no wonder, but that's a big time. Millions worldwide have been comforted by Amma's embrace and inspired by her message of love, selfless service, and equality for all. You, all of our listeners, are warmly invited to come and meet Amma, hear her message, and receive her individual loving embrace. Join Amma and those inspired by her vision in this festive celebration. Free public programs, again, will be held in Albuquerque this June 20th and 21st at the Marriott Pyramid North off I-25, just south of Paseo del Norte. And I don't have the times, so you can go visit amma.org. That's AMMA.org. And we're going. We have friends who are very much involved in her programs and really sort of guide their life by her. And
She's been compared to Mother Teresa.
yeah, I mean, she's wonderful. So we're very excited. You bring if you have children, you can bring your children. There's an entire child care program there throughout. She's there for like, I think 3 or 4 days. And for every single day there's child care. So she does something called darshan, which is, I could be saying this wrong, so please forgive me for those of you who do know what it is exactly. I think it's a blessing to the family or to something new or something like that within a new person in the family. I'm not sure. But she does that. I think it's a family blessing.
I saw an Amma bumper sticker the other day.
Oh, there's plenty of them. My friends have them. Anyway, she does that and for hours and hours and hours. She'll do it for over 12 hours straight without taking a break, and it's really awesome. We're excited. We're bringing our kids. We know the person who's the director of child care there, and it's fun. So, I mean, if you're not doing anything on those days, I would recommend trying it out. It definitely can't hurt.
AMMA.org.
Right. Okay. Now, so here's something I saw at the beginning of the week that I actually texted my husband about right away, and I said, here's something we should talk about, because it's really interesting, and it's sort of a hot topic right now. There is a former news anchor for Fox News, E.D. Hill. It's, the letters E, the initial D, Hill. She's a conservative journalist, and she just had in this past winter, late winter, a prophylactic double mastectomy. When asked why, she said she has a serious family history of it, and she herself had never had a shred of evidence of cancer within her, luckily, but that every year for many years she's been going to get her breasts checked about 9 times a year.
And it just weighs very heavily.
Exactly, that's another thing she said.
Women who have this, incredibly strong family history.
So she said, exactly that. She said, I just couldn't deal with it anymore. She said, I can't live my life like this, wondering if cancer's lurking around the corner. So she looked into it, and this is not a choice for everybody. This is a very, in some people's eyes, drastic way to deal with it. I actually think it's something I would do if I had this type of history in my family. But she felt it was the right choice for her, and she feels free now. She got a double mastectomy and complete reconstructive surgery. Right. And she loves her new breasts because they're implants, they're perky, they're everything she wants them to be. She said they're better than her old ones. They're the same size. She has the same bra cup size. And so her body really hasn't changed. She just has nice perkier breasts than she had before, and they're cancer-free. Right. So she feels very, very relieved.
It's not for everybody.
No.
I mean, it's a very serious operation.
And we are not endorsing this by any means.
No.
We're just talking about it
It's
'cause it's a hot topic.
And the reconstruction is not easy. A bilateral reconstruction is a big deal, and an implanted breast after a mastectomy is very different from a natural breast.
Right.
Yes, it can look perky and higher than the regular breast, but it doesn't feel the same. There isn't that, softness of the breast. There are many ways to reconstruct breasts.
Okay.
Go ahead.
That's
sorry.
because it's reconstructed tissue?
Right.
It's not
well,
soft?
because the mastectomy has removed the softness. They
All right,
removed the
okay.
breast tissue.
So what a woman feels with full breasts that are intact with an implant, there's
Right.
sort of that cushion
right.
above
right.
the
And somebody
implant?
who's had a mastectomy, all you're feeling is the muscle and a little bit of fat under the skin, but
Interesting.
just about everything else has been removed. And so, with the new silicone implants, they feel pretty natural, so it's okay. And most reconstructions these days are done with silicone implants.
Oh, really? She didn't
Mhm.
specify what she had.
I'm sure she had silicone implants.
Okay.
That's sort of the standard now. And then there's other kinds of reconstruction where you can use your own tissue, such as the abdominal tissue.
She talked about that. She was very thin. She had no
Right.
fat to
It's a
speak
tram
of. So.
flap. That's a huge operation
Yeah.
too, and it can leave contour deformities in the lower abdomen and hernias.
Huge scars too.
Well, it looks like a tummy tuck scar.
Oh,
Yeah,
okay.
you can make a tram look very nice.
Nice.
But to do a bilateral tram, that's a big deal, and it requires a lot of counseling. And my point is, she went to a great team of doctors who do this very often. She thought about it for a long time.
Oh, yeah.
And for her, it was the right decision. And
Right.
she's a young, healthy, thin woman, and so her outcome is very good. It's not the same for everybody.
And this by no means is the choice for you. Many people are very attached to their breasts.
Right.
And so to lop them both off is not going to work for them
Right.
psychologically.
And so there are criteria for doing it, and she, I'm sure, was counseled by her breast surgeon, and the criteria are a very strong positive family history with first-degree relatives, not just a cousin.
No,
or
no,
even
her
a
mother
grandmother.
had severe.
Mother,
yeah.
sisters. I have patients who've had several sisters and mothers who've had it. And there's a gene test called a BRCA test, BRCA, which is pronounced BRCA. And if you have a positive BRCA gene, if you have that gene, you're very, very likely to have breast cancer within your lifetime. Now, not everybody who's going to get breast cancer has a positive BRCA gene, so it's not just a test for breast cancer. But if you are one of those people that has it, then that's a very good criteria for having a prophylactic mastectomy. For example, if you have breast cancer on one side, a lot of people go ahead and take off the other breast as well,
That I've
so
heard.
that they don't get breast cancer on the other side.
And so that they look symmetrical too.
Right, that's also another consideration, is when you reconstruct just one breast, it's hard to make it match the other breast.
Right.
So if you meet the criteria and you have counseling, then it's an option that's worth discussing. But really, it's not for everybody, because it's not just it's not a chip shot. It's not it's not like having a bilateral breast augmentation, which is done millions of times a year. This is very serious. This
Yeah,
is different.
this is preventing cancer, so
Yeah.
you bet it ain't gonna look, like a regular old breast dog.
Yeah, but I'm sure that she's very relieved, and
She seemed it. I saw her on The View, if I didn't already say that, and she just seemed like, not that I had seen her or knew her before, but the way she was talking about it, you could see and feel the lightness she had versus the weight she had when she talked about her life before this double mastectomy.
Right. If you have more questions about it, please feel free to email or write in. My email is info@danielronelmd.com, and you can call, and if you have questions about it, I'm happy to talk to you if you're considering having this done.
Again, we do not endorse this by any means. It's just a topic that's up in the news these days when it comes to health.
Mhm.
So we're bringing it up, and we have wonderful breast surgeons here in Santa Fe
Right.
who could certainly consult with you too. Who are they?
Yeah, Anna Valtora is one of the premier breast surgeons
Right.
around here, and she's terrific.
Okay. Good.
Okay, thanks very much. We'll be right back. We're going to listen to a tip from Dr. Rita Dodge. Stay tuned. We'll be right back.